you ever asked your oncologist what you should be eating during cancer treatment or afterwards to keep your cancer from coming back? If so, let me guess. They either told you to simply eat a balanced diet or just eat what you normally do. This is horrible advice. What frustrates me so much is that most doctors know that eating the right foods can support your treatment, reduce treatment side effects, and significantly increase your chances of becoming cancer-free or staying in remission. So why aren't more oncologists talking to their patients about nutrition, even though most of them know how important it is? In this video, I'm going to let you in on a secret that your doctor doesn't want you to know, and some important things that you can do if you haven't received adequate counseling on cancer nutrition from your doctor or healthcare team. I can't even begin to tell you how many times my patients have told me that their oncologist told them to just eat burgers or fries, or to drink those canned milkshakes like Boost or Ensure during cancer treatment. These shakes contain more sugar and chemicals than most ice cream. Yep, exactly what your body doesn't need. Sugar weakens your immune system and creates inflammation in your body, which increases your risk of having negative side effects from cancer treatment. However, while you're going through cancer treatment isn't the time to try to lose weight or be dieting because A, you'll need nutrients to keep up your strength, and B, you already have a lot on your plate with medical appointments, treatment side effects, and not to mention all of the stress that comes along with it. Also, if the only thing you can stomach or tolerate during treatment is a milkshake, then by all means go for it. But a healthy alternative to a milkshake would be to make your own smoothie. Now before I go on, I really need to say something. I'm not trying to bash or insult your oncologist. I have no doubt that they're a highly skilled medical professional who can provide you with the most effective treatments like chemo, radiation therapy, or surgery, for example. And this is certainly way more important than nutrition when it comes to curing cancer. So it's really important that you trust your oncologist's recommendations for cancer treatment because they are what will save your life. However, proper nutrition can and should be used to support these treatments, so I wish more doctors would talk to their patients about it so it's clear to them what they should be eating and what they should be avoiding during cancer treatment and beyond. In fact, nutrition makes such a big difference that it should be mandatory for all cancer patients to receive personalized nutrition coaching to address their individual needs based on their cancer diagnosis, the treatment side effects they may have, and their overall health. This advice could really help them manage things like nausea and fatigue from treatment, or what to eat to keep up their strength when they don't have an appetite. But why isn't this happening? Well, here's where I'm going to let you in on a secret that your doctor doesn't want you to know. Despite the fact that they likely know how important nutrition is, they barely received any proper education on it when they were in medical school. Most medical schools worldwide dedicate less than 25 hours to education on general nutrition in an entire 5 or 6 year program. That's nowhere near enough. So because of that, and this is from a recent study I found, 87% of doctors say they lack the training and confidence to be able to talk to their patients about nutrition. However, several doctors and healthcare professionals have a personal interest in nutrition and study it on our own, like myself, so that we can better support our patients. Now, one could argue that it's not a doctor's responsibility to educate patients on nutrition because they already have to stay up to date on how to diagnose and treat thousands of different diseases. But having worked in healthcare for so long, I know that most patients will follow their doctor's advice over anyone else's. Am I right or am I right? But what's happening is that patients are leaving the doctor's office and saying, well, my doctor didn't even mention what I should be eating, so I guess it doesn't matter. Wrong. But it's not only your doctor's fault. The entire medical system is built to diagnose, prescribe, and treat patients. But it doesn't aim to help people prevent illnesses by making healthy changes that would often fix the root cause of the problem. This has been an issue for centuries, but there weren't as many food-related health problems even 30 to 40 years ago. People didn't consume nearly as much refined sugar or processed foods, and there weren't nearly as many cases of diabetes, obesity, and other chronic illnesses that often lead to cancer. We also know a lot more about nutrition now more than ever, which foods will help us beat cancer and which can cause cancer. It's talked about on TV and all over social media, so most people have a general idea of what it takes to have a healthy diet, but that doesn't mean that they actually have a healthy diet. Knowing is a lot different than doing, right? So not only do cancer patients need and deserve to be educated more on what to eat to beat cancer, they should also be supported in making healthy dietary changes if need be, because that is what's most difficult. We're not taught in school how to reduce our sugar cravings or which foods to eat to decrease inflammation and kill cancer cells. Something else I find really frustrating is that it would be easy for most cancer centers to have specially trained nutrition coaches that can sit down with all patients and help them make healthy changes to their diet and lifestyle, but very few centers are doing this yet. And I say yet because I truly believe that very soon in healthcare overall, we will be incorporating more lifestyle-focused medicine by encouraging dietary changes, exercise, and stress management to help our patients prevent and better manage disease. Now, as promised, I wanted to give you some tips on what you can do if your oncology team didn't provide you with any nutritional education for your personal diagnosis. Number 1, don't hesitate to bring up the topic of nutrition during your consults. Ask your oncologist where you can get nutritional support within your community. There may be a nutrition class at the hospital or an in-house dietitian that they can refer you to. Number 2, some doctors genuinely don't see any value in nutrition, which is obviously not good, but if that's the case, please take whatever they say about nutrition with a grain of salt. For example, if they tell you to just eat whatever you want or to try to fill up on milkshakes, you don't have to tell them that that's horrible advice, but you can take the initiative to try to educate yourself on cancer nutrition, because the more you understand about how different foods affect your body, the more likely you'll be to eat these foods and continue to eat them for a long time to come. Number 3, there's a lot of false information out there on what can help you beat cancer. So if you're doing your own research, please be sure to only listen to reliable sources like government or hospital websites, or right here on this YouTube channel. I have a few videos that I'll link in the description below for you, and they'll help you to know which foods you should be prioritizing because they'll give you the most bang for your buck in terms of nutrients and antioxidants. And in my video titled The Best Superfoods to Fight Cancer, I also provide you with delicious recipes that are full of cancer-fighting foods, so you don't want to miss that one. I've also included a link below for you that will give you access to a full list of cancer-fighting foods that you can download or better yet print out and put it on your fridge. Number 4, if your hospital isn't able to refer you to a dietitian or nutritionist, see if you can find one online and if your insurance will cover it. Talking to an expert one-on-one can ensure that making any dietary changes is actually safe for you, and they can give you advice that is tailored to your specific diagnosis and needs. They can also help you avoid weight loss, malnutrition, or weight gain during cancer treatment, which is very common. A lot of cancer patients expect to lose weight during treatment, but they actually end up gaining weight because maybe they're not able to be as active as usual, typically their stress levels are higher, and maybe they're allowing themselves to eat more comfort food than usual. There are several reasons why it's common to gain weight during cancer treatment, so if it happens to you, please know that you're not alone. The good thing is that we now know so much about the healing powers of certain foods that nutrition is slowly being integrated into the healthcare system, and more medical professionals like myself who have a personal interest in nutrition are talking to our patients about it more now and even incorporating it into their treatment plan. And since we know that several illnesses like type 2 diabetes and heart disease are preventable and treatable by making healthy diet and lifestyle changes, I think the future of healthcare will focus more on helping people do just that, rather than prescribing them medication that doesn't fix the root cause of the problem. So we can only hope that cancer patients will also benefit from a more holistic and integrated approach to their care so that they can have improved treatment outcomes, faster healing time, and an enhanced quality of life. I'd really love to know in the comments below if your healthcare team provided you with any education on cancer nutrition while you were going through treatment. And I'd really love to thank all of you who have already subscribed to this channel, because the more subscribers it has, the more YouTube will show these videos to people who can benefit from them as well. Bye for now.